Knee pain, it's a common complaint, but when is it time to see a doctor? Here to talk about it is Dr. Joshua Frank, an orthopedic surgeon at St. Vincent's Medical Center. Thanks so much for being here with us today.
Thanks so much for having me.
So let's start out by talking about some of the more common knee injuries.
Sure. So, the most common things people experience are often tendinitis and some overuse injuries, particularly as we're getting more active after this long stretch of COVID. But there are some much more serious injuries that people have heard of, such as meniscal tears, ACL tears, and some more rare things that are just as important to pick up, injuries to the cartilage or dislocations of the patella or your kneecap.
Some of the injuries are pretty obvious to know when you go to a doctor, but maybe if you have a little bit of lingering pain, when is it time to go to a doctor?
Sure, that's a question we get all the time, especially from parents. The obvious things, such as you can't bear weight on the leg, it's very swollen, stuck in one position, of course you're going to seek immediate care. If something has full range of motion, you're able to put all your weight, not too much in the way of swelling, pretty reasonable to give it a couple of days, a little ice and some local treatments. But if things linger on more than that, it's often best to get it checked out and get a good diagnosis early.
Talk us through some of the treatment options that are most commonly used.
Sure. So, it's a tough question, really, because there's such a wide spread of injuries. Most of the tendinitis overuse things can be treated with medicines, local things like ice, stretching, formal physical therapy is probably the mainstay of treatment. But it's really important to diagnose the condition so that we can treat it appropriately. The majority of things we see in the office seldom require surgery. But even the same injury in different patients can be treated differently. So it's really about individualized care.
And Dr. Frank, you actually have an upcoming webinar on the topic. Tell us the details for those who may be interested in learning more.
Yeah, thank you. So on Thursday, July 15th at 4 p.m., I'll be leading a free virtual class offering an in-depth discussion on knee injuries, causes, non-invasive treatment options. It will wrap up with a question and answer session.
All right, Dr. Joshua Frank, surgeon with the Connecticut Orthopaedic Institute. Thanks so much for joining us.
Thank you very much for having me.